Topic is carbuncle. Hello dear students, today we will discuss an infective condition, not uncommon, especially in the back and nape of the neck and mainly in diabetic patient. Look at this. See that? Here, see that? There are two possibilities to look like that, red, sieve-like pattern, like a charcoal, red charcoal. Understood? There are two possibilities in this patient. Look at that. It is carbuncle in the sacral region diabetic patient. It could be other possibilities, infected pyelonephrosis, abscess or sinus. Typical pyelonephrosis sinus. There is also possible. But look at this areas, that redness, like a dark colored area with this multiple, this one. So that looks like a first thing is a carbuncle only. Second possibility, in this region, you have to also think of pyelonephrosis abscess. So there are two possibilities. So we'll discuss about the carbuncle. What is it? So it's an infective gangrene of the skin and subcutaneous tissue involving group of hair follicles extensively. And single hair follicle is involved. It's a different entity, whereas here group of the follicles are involved. So carbuncle is caused by Staphylococcus aureus. There is the bacteria. Again, MCQ question. Nape of the neck and back is the commonest site. Common in males. Red hot charcoal-like. There is the word meaning. Carbuncle means red hot charcoal-like. Sieve-like vesicles with ash grey slump. Again, MCQ question. Rosette-like ash grey slump is typical. And constitutional symptoms: uncontrolled diabetes, ketosis many times, toxicity, extensive necrosis in the deeper plane, like a black curd, multiple discharging pus, purulent, foul smelling sometimes. Skin is destroyed completely. Destruction of the skin and subcutaneous tissue. Swollen skin also important. So management is blood sugar, urine ketone bodies, control of diabetes by insulin, good antibiotic coverage, sometimes systemic antibiotics, higher generation antibiotics. You may have to admit such patient. You have to see the blood urea, creatinine. You have to see blood sugar, HbA1c, total count, C-reactive protein, hemoglobin, albumin level, everything you have to assess. Then treat the diabetes with insulin, surgical drainage and adequate wound debridement. It's very, very important. Drain it properly with a cruciate incision like this. And go deep and remove all infected tissues. If you retain, it won't heal. It will spread. It's a spreading, remember. It's a spreading one. In fact, it spreads in the deeper plane. You think it is small one, while you open it, it will become much wider than that. So remove all infected dead tissue. Necrotic tissue is very, very important. And continue antibiotic, control the treatment infection, control the diabetes. Then regular dressing you do, pack the cavities. Once it granulates well, either do second suturing if it is possible. If it is wide area, then put a skin grafting at a later date. That's the treatment. But initial management is very, very crucial. That's the most important in case of. Remember, it is an infective gangrene of skin and subcutaneous tissue involving extensively multiple hair follicles. So this is a typical carbuncle. Look at that. Have exactly sieve-like pattern, covering area, charcoal-like. The word meaning very clearly seen here. And answer the MCQ. Ray fungus is Mozzarella mycetomy, actinomycosis Israeli, Nocardia madre, Nocardia asteroides. Students, put the answer in the comment box. I will give the right answer later. So students, always go through my SRB clinical methods and surgery, where everything, examination part, of course in video, how to examine is there in my book through JP Publishers, 4th edition. It contains all topic. For example, mass abdomen, swelling, ulcer, artery disease, venous disease, thyroid, and so on. All topics with the video contain lot of photos and illustrations. So students, I hope you have understood this carbuncle topic very well. Thank you so much.